Well, ladies and gentlemen, may I have your attention, please? Our session is about to begin. Please have nice seat and thank you. Bismillahirrahmanirrahim. Good morning and Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin. Assalatu wassalamu ala anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in amma ba'du. Excellencies, the Dean and Vice Dean of Faculty Health Sciences, Universitas Muhammadiyah Lamongan, the Director of Office of International Affairs, Universitas Muhammadiyah Lamongan, Honorable to our lecturer from INTI International University of Malaysia, Professor Dr. Gita Subramaniam, all the lecturer of Faculty of Health Sciences, Universitas Muhammadiyah Lamongan, and also all beloved participants in this event. Welcome to the guest lecture of Faculty of Health Sciences, Universitas Muhammadiyah Lamongan. I am Abralia Afidatul Hanafi, nursing lecturer from Faculty of Health Sciences, Universitas Muhammadiyah Lamongan, and it's my honors to be the Master of Ceremony for today's event. Ladies and gentlemen, before we begin our agenda, please allow me first to read the agenda for today's. The first agenda is opening. The second agenda is reciting Holy Quran. The third agenda is singing Indonesian national anthem and March Muhammadiyah. The fourth agenda is opening speech. The fifth agenda is lecturing, and the last agenda is closing. Ladies and gentlemen, to begin this event, let's recite Basmalah together. Bismillahirrahmanirrahim. The next agenda is recitation of Holy Quran, which will be delivered by Muhammad Wildan Nabil Agung Pamudi, a student from Nursing Study Program, Universitas Muhammadiyah Lamongan. To Nabil, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Alam tara ilal ladzina baddalu ni'matallahi kufran wa ahallu qaumahum daral bawar. جهنم يصلونها وبئس القرار وجعلوا لله أندادا ليضلوا عن سبيله قل تمتعوا فإن مصيركم إلى النار قل لعبادي الذين آمنوا يقيموا الصلاة وينفقوا مما رزقناهم سرا من قبل من قبل أن يأتي يوم لا بيع فيه ولا خلال الله الذي خلق السماوات والأرض وأنزل من السماء ماء فأخرج به من الثمرات رزقا لكم وسخر لكم الفلك لتجري في البحر بأمره وسخر لكم الأنهار وسخر لكم الشمس والقمر دائبين وسخر لكم الليل والنهار وآتاكم من كل ما سألتموه وإن تعدوا نعمة الله لا تحصوها وإن تعدوا نعمة الله لا تحصوها إن الإنسان لظلوم كفار صدق الله العظيم والسلام عليكم ورحمة الله وبركاته.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much. For the next agenda is singing Indonesian National Anthem and March Muhammadiyah. All the audience, please rise.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Excellency Professor Dr. S. Gita Subramaniam from INTI International University Malaysia, respectable Al Vice Dean, Head of International Affairs, Lecturer of Faculty of Health Science, Universitas Muhammadiyah Lamongan, and all my students whom I love. First of all, let's pray and thanks to God, to our God Allah Subhanahu wa Ta'ala, who has been giving us some mercies and blessings, so we can attend and meet in Auditorium Bidi Utomo in good condition and happy situation. Secondly, my peace and salutation always be given to our Prophet Muhammad Sallallahu Alaihi Wasallam, who has guided us from the darkness to the brightness, from the stupidity to the cleverness, from Jahiliyah era to the Islamia era, namely Islamic religion that we love. So by his guidance, we are able to differentiate the good thing and the bad one, the right way and the wrong one, in order to enter God's paradise. Thirdly, I'd like to say welcome to Professor Dr. S. Gita Subramaniam from INTI International University Malaysia in Universitas Muhammadiyah Lamongan. Thank you for your time to give guest lecture in Faculty of Health Science about the theme Transforming Digital Health Science. We hope you can deliver information and knowledge about that topic for our student. To all my students, I am sure you will get a lot of advantages. You can improve your English and add new insight about transforming digital health service. Please do participate in the golden opportunity, and I hope your participation will bring some benefits. Next, with recitation of Bismillahirrahmanirrahim, the guest lecture event with the theme Transforming Digital Health Service is officially opened and started. Okay, I think my speech is enough for this time. If you find some mistakes in my remarks, I hope you do apologize me. Thanks a lot for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much for Dr. Virgianti Nurfarida. Now is the main agenda, which is lecturing from our guest lecturer, where the topic is transforming digital health services. We are honored to have Professor Dr. Gita Subramaniam from INTI International University of Malaysia as our distinguished speaker. And also to guide us through the session, we have Mrs. Yeni Tri Nurhayati, lecturer from Physiotherapy Study Program, who will lead the discussion and facilitate the question and answer session. So without further ado, I hand over this session to moderator. Please come forward, Ms. Yeni.
Okay, thank you very much to the MC for giving me time to lead the session today. Okay, Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Welcome to today's agenda guest lecture. I'm very pleased to see you in here. So I'm Yeni Trinurhayati. I will be the moderator of this session in the guest lecture, Transforming Digital Health Services. Before I introduce the session presenter, let me inform to you all just a few suggestions. Okay. Ladies and gentlemen, our speaker today in this session, Professor Dr. Gita from the International University of Malaysia. With the topic is Transforming Digital Health Services. She is a Professor Dr. Gita. She is Professor Faculty of Health Science, Life Science in the International University of Malaysia. She is a Bachelor of Science in University of Malaya and Doctor of Philosophy in University of Malaya. She is teaching education and training and learning strategies and project-based learning, etc. Research focus in diagnostic microbiology, antibiotic resistance in skin pathogens, antimicrobial properties of medical plants. Okay. Before the presentation begin, let me inform how the presentation will be going on. First, Professor Dr. Gita will be invited to present the material for an hour. After that, there will be question and answer session for 30 minutes. And this session will be divided to session, and each session 3 till 4 questions. Okay. Now allow me to welcome the speaker, Professor Dr. Gita, to deliver your presentation. Hello, Professor.
Hello, good morning. Can you hear me?
Yes, I'm hear you.
Okay. Can you see my screen?
Yes, sir. Yes,
Okay.
yes, Prof.
Okay, I'm going to start the slideshow. If you
Okay.
don't mind, I will also speak in Bahasa, English and Bahasa, if that's all right.
Yes.
Okay. Thank you very much. Good morning, everyone, ladies and gentlemen. It's such an honor for me to be here, to be invited by the wonderful members of the Faculty of Health Science, Universitas Muhammadiyah Lamongan. Thank you very much for this honor, and I'd like to share a little knowledge about how technology can improve the delivery of digital health services. So, what is digital transformation? It's the process where we use digital technologies to change business processes, culture, and customer experiences, all with the sole goal to improve the process and meet changing business and market requirements. So digital transformation is very wide. Transformasi digital tujuannya adalah untuk meningkatkan proses dan memenuhi perubahan kebutuhan bisnes dan pasar. So it's not only in healthcare, it's global. It's in every process. Transformasi digital semakin cepat terjadi di berbagai industri di seluruh dunia. Menurut Statista, pengeluaran global untuk transformasi digital diperkirakan akan mencapai USD 3.4 triliun pada tahun 2026. Lebih dari 2 kali lipat jumlah pengeluaran pada tahun 2022. Pertumbuhan pesat ini menunjukkan bahawa inisiatif digital diprioritasikan sebagai hal yang penting di hampir setiap industri termasuk layanan kesihatan. So you can see the huge investment in digital transformation, not only in healthcare, but in other global services that has almost tripled since 2022 and is estimated to reach 3.4 trillion by 2026. So let's look a little closely at digitalization in healthcare. So the integration of digitalization of the technologies is into all aspects of healthcare, whether it is management, it is operations, it is any of the branches of healthcare. It could be radiology, physiotherapy, anesthesiology, diagnostic, microbiology, so many different aspects. Structured applications. It is basically structured applications of technology to address the challenges that are prevalent in healthcare. So, apa itu digitalisasi dalam pelayanan kesihatan? Digitalisasi merevolusi layanan kesihatan dan meningkatkan kualitas layanan. Kemajuan teknologi telah menyebabkan pasien lebih sering memanfaatkan internet untuk memperolehi pengetahuan tentang kesihatan mereka, terutama mengenai kondisi seperti kanser dan penyakit kronis. The internet has a wealth of information, and unfortunately, patients are trying to self-diagnose themselves by looking up the internet and trying to determine what is wrong with them. This is very dangerous. But moving forward, digitalization in healthcare can take that problem and turn it to the patient's advantage. So akibatnya, individu kembali ke penyedia layanan kesihatan mereka dengan wawasan dan pertanyaan baru. So proses ini pada dasarnya menumbuhkan peningkatan kesedaran dan menunjukkan bagaimana masyarakat memanfaatkan internet untuk meningkatkan lagi pemahaman mereka tentang kesihatan. Layanan kesihatan digital lebih dari sekadar menggunakan teknologi. It's more than just doing a Google search. It is far in depth. Ini bukan saja mencari gejala di Google dan mengambil kesimpulan sebelum menemui doktor. Bukan itu tujuan kami. Sebaliknya, ini adalah tentang penerapan solusi teknologi yang bijaksana dan terstruktur yang benar-benar mengatasi tantangan layanan kesihatan. Digital transformation enabling better healthcare. The most important thing is that it was highlighted during the COVID pandemic. The hospitals, people were under lockdown. We couldn't leave the houses. What about those of us who needed medication and treatment, but were not so sick that we couldn't enter hospitals? The hospitals were closed to accommodate COVID patients and critically ill patients. So, ladies and gentlemen, pentingnya teknologi perawatan kesihatan di rumah telah menjadi perhatian selama pandemik COVID-19. Ketika lockdown global dan perlunya pembatasan sosial telah menimbulkan tantangan besar bagi individu yang mencari layanan kesihatan tahap muka. Pandemik COVID-19 berperan sebagai katalisator transformasi layanan kesihatan digital, mempercepatkan adaptasi teknologi dalam berbagai aspek pemberian layanan kesihatan. Penggeseran ini tidak hanya meningkatkan akses terhadap layanan kesihatan tetapi juga membuka peluang bagi inovasi berkelanjutan di sektor kelayanan kesihatan. So it contributed to the enhanced efficiency, streamlined healthcare operations, and even cost reductions of having the patients travel to the hospitals. They could sit in the comfort of their homes and seek medical attention from their doctors. That was amazing. COVID pandemic forced us into adopting even faster digital transformation in healthcare. Saat ini semakin banyak penyediaan layanan kesihatan yang menggunakan transformasi digital untuk menjadikan segalanya lebih baik seperti ditunjukkan di dalam grafik ini. Menurutkan laporan Future Market Insights, transformasi digital global di pasar layanan kesihatan diperkirakan bernilai USD 65.2 miliar pada tahun lepas 2023, 2 tahun, sekarang kita dalam tahun 2025, dan diperkirakan akan mencapai USD 253.6 miliar pada tahun 2033. So this is the amount of investment globally into the healthcare market using digital transformation, because physicians, doctors, healthcare professionals all over the world see the benefits, the immense advantages both to the healthcare providers and the patients with digital transformation. So what are the aims of digital health services? Why are we doing this? To improve access to healthcare, streamlining healthcare operations, facilitating data sharing and collaboration, supporting personalized medicine, improving health outcomes, reducing healthcare cost, enhancing quality of care, and promoting preventive care. Let me explain each point a little bit more detail. Layanan kesihatan digital bertujuan untuk meningkatkan akses terhadap layanan kesihatan, improving access to healthcare. Meningkatkan accessibility terhadap layanan kesihatan terutamanya bagi individu di daerah yang terpencil atau kurang terlayani melalui telehealth dan konsultasi online. In addition, They are trying to streamline healthcare operations, menyederhanakan operasi layanan kesihatan, meningkatkan efisiensi dalam pemberian layanan kesihatan dengan mendigitalkan proses seperti penjadualkan janji temu, penagihan dan menjaminkan catatan patient. So they try to facilitate data sharing and collaboration, memfasilitasi berbagi dan kolaborasi data. So if you are in one hospital or being treated by a doctor in one hospital, you need treatment from a specialist in a different hospital. With data sharing in digitalization, the doctors from hospital A can share your information with hospital B. So there is a more efficient transfer of information, so the physician in the second hospital can treat you more efficiently, more thoroughly, and more insightfully. This is what data sharing. Memungkinkan pertukaran informasi pasien yang lancar di antara penyedia layanan kesihatan untuk meningkatkan koordinasi perawatan dan mengurangi duplikasi layanan. We are saving time. We are making the process more efficient. In addition, supporting personalized medicine. What is personalized medicine? That is tailoring the medicine and services to the individual patients. And with digitalized healthcare, this is made more possible. Mendukung pengobatan yang personalisasi, memanfaatkan analisis data dan kecerdasan buatan untuk menyesuaikan perawatan berdasarkan kebutuhan dan preferensi masing-masing patient. Personalized medicine is becoming more and more common among hospitals. It's very prevalent in the private hospitals in Malaysia, but the government hospitals are adopting digital health and are also supporting personalized medicines. In addition, we want to improve health outcomes, meningkatkan hasil kesihatan dengan memanfaatkan teknologi untuk memantau kesihatan pasien secara terus-menerus sehingga menghasilkan intervensi yang tepat waktu dan hasil kesihatan yang lebih baik. And then there's reducing healthcare costs. How? The patient doesn't have to go all the way to the hospitals. The hospitals don't have to have more clinics, more nursing staff and hospital staff when they can easily collaborate through telemedicine, through visualization and digital healthcare. We are not saying that the patients stop going to hospitals, no. But where the patient can stay in the comfort of their home and still receive the benefit of the expertise of the physicians, the healthcare providers, the physiotherapists, the traditional Chinese medicine specialists, then it is much better. So dengan mengurangi biayai layanan kesihatan, ini mengurangi biayai operasional dengan mengoptimalkan alokasi sumber daya dan meminimalkan kos yang tidak perlu melalui pemantauan dan konsultasi jarak jauh. We also look to enhance quality of care, meningkatkan kualitas layanan, menerapkan praktis berbasis bukti yang didukung oleh analisis data untuk meningkatkan kualitas layanan kesihatan yang diberikan secara keseluruhan. And finally, looking at promoting preventive care, mempromosikan perawatan pencegahan, dengan mendorong tindakan kesihatan preventif melalui sumber daya pendidikan, peningkat pemeriksaan dan fitur pelacakan kesihatan dalam aplikasi digital. This has improve the quality of healthcare in leaps and bounds. It is prevalent. More than 70% of healthcare services in America and Europe already practice digitalized health services with highly improved patient outcome and positive responses from the patients and the physicians themselves. In Asia, we are starting to adopt. China, Japan have already started very aggressively. So we in Southeast Asia are also going to adopt this because we can see the benefit to our patients, to our healthcare system. So what are the drivers of digital transformation? We have technological advancements like cloud computing, artificial technology or AI, big data, Internet of Things, IoT. So kemajuan teknologi, perkembangan pesat dalam sektor ini seperti komputasi awan, kecerdasan buatan AI, data besar dan Internet of Things IoT. Semua ini memungkinkan organisasi untuk meningkatkan lagi operasi dan pengalaman pelanggan mereka. Then we have changing consumer expectations. This is a little tricky because patients somehow still feel, especially the elderly, they want that personal touch. But we are trying to make it personal with telemedicine, and I'll explain that in a little later. So, mengubah ekspektasi konsumen. Pelanggan semakin menuntut layanan yang dipersonalisasikan, yang lancar, yang efisien. Dan organisasi harus beradaptasi dengan harapan pasien dan melalui solusi digital yang meningkatkan pengalaman pengguna. Then we have competitive pressure, tekanan kompetitif. Kebutuhan untuk tetap kompetitif di pasar yang berkembang pesat mendorong organisasi untuk mengadoptasi teknologi digital untuk berinovasi selagi meningkatkan penawaran mereka. And then there's operational efficiency. Efisiensi operasional. Transformasi digital bertujuan untuk menyederhanakan proses, mengurangkan biaya dan meningkatkan produktiviti dengan mengotomasikan tugas-tugas yang rutin dan meningkatkan manajemen data to make sure that there is a more efficient optimization of routine operations that can easily be done using digital platforms. So we remove the mundane and focus on more personalized medicine for the patients, which makes them have more confidence in the healthcare systems. Pengambilan keputusan berdasarkan data-driven decision making, that is extremely important as well. Kemampuan untuk mengumpulkan data dan menganalisiskan data ini dalam jumlah besar memungkinkan organisasi membuat keputusan yang tepat, mengidentifikasi trend dan mengoptimalkan strategi. In addition, there must be regulatory compliance. This is not just being done by individuals who want to look very savvy, technology savvy. No. Anything that's done in the healthcare system must obtain regulatory compliance from the individual governments. The governments must give the green light for digital transformation to be integrated into healthcare services. Kepatuhan terhadap peraturan. Kepatuhan terhadap peraturan industri seringkali memerlukan penerapan alat digital untuk pengelolaan, pelaporan dan keamanan data yang lebih baik. And then there's, of course, globalization. Globalisasi seiring dengan secara global, Transformasi digital memfasilitasi komunikasi, kolaborasi, dan konsistensi operasional di berbagai wilayah. Workforce empowerment. We need to empower our staff to be digital savvy so they can seamlessly integrate into this digital transformation for the benefit of the patient, of the healthcare provider, of the healthcare system. Perberdayaan tenaga kerja. Alat digital memungkinkan karyawan bekerja lebih efektif dengan menyediakan akses terhadap informasi dan sumber daya dari jarak jauh sehingga mendorong kolaborasi dan inovasi. Are there any questions so far?
No, Prof. Can you?
I will carry on then. Thank you very much, Madam Moderator. Right. Di bidang kesihatan digital, terdapat 3 bidang utama yang memainkan peranan penting dalam memajukan layanan kesihatan digital. There are 3 main players in the digital health landscape propelling digitalization in healthcare forward. They are telemedicine, wearable technology and health apps, and electronic health records. So I'm going to go into each of these with a little bit more detail. Salah satu dampak yang paling berpengaruh dari transformasi digital dalam industri kesihatan dapat dengan mudah dikenali melalui peningkatan kunjungan doktor secara virtual. We need to see our doctor, and if we can't see him physically, face to face, we still can see him very clearly using telemedicine. And this became more and more popular and integrated into our healthcare systems during the COVID pandemic. Ketika pandemik COVID-19, ia sangat mengganggu layanan tahap muka pada tahun 2020. Perhatian semua orang berlatih ke telemedis. Hasilnya, jumlah telekonsultasi melonjak hingga pasien dapat membuat temu janji medis dan berkonsultasi dengan doktor dari kenyamanan rumah mereka melalui video, audio dan juga pesan. So telemedicine has become so much a part of lives, particularly in the United States, Europe, China, Japan, and several other countries. It is becoming a reality for us. Just wait and see. Telemedis mengacu pada penyediaan layanan klinis jarak jauh melalui komunikasi 2 arah secara real-time antara pasien dan penyedia layanan kesihatan menggunakan sarana audio dan visual elektronik. So basically, telemedicine refers to the healthcare provision services via real-time two-way communication between the patient and the healthcare provider using electronic audio and visual means. This can be through your handphone, it can be through your desktop. Do you know telemedicine existed late 1950s and early 1960s? But it wasn't so prevalent and popular because it wasn't financially viable. The technology in the 50s and 60s was limited. The hardware, software, internet access was virtually nil. So telemedicine technology then was very expensive and very slow. But now, thanks to the COVID-19 pandemic, it has zoomed to become one of the healthcare providers' foremost methods of communication with patients. Tahukah anda, telemedis telah sejak akhir tahun 1950-an, namun adaptasi secara luas tidak mungkin kerana finansial hingga ke abad ini sahaja. Penerapan telemedis secara umum dibatasi pada zaman dulu oleh kebijakan teknologi dan ekonomi. Keterbatasan teknologi meliput perangkat keras, perangkat lunak dan akses internet. Luckily, that is not the case now. And there are many platforms, online platforms that support telemedicine. And one of the examples is ZocDoc. ZocDoc is an online platform that connects a patient with trusted healthcare professionals. It was actually founded in 2007 by an emergency room physician who wanted to make it easy and convenient for people to find doctors and to schedule appointments online. Today, ZocDoc has over 25 million patients in the United States alone and 50,000 doctors on its platform. Contoh platform telemedis adalah ZocDoc di United States. Platform online yang menghubungkan pasien dengan profesional kesihatan terpercaya. Didirikan pada tahun 2007, ini diciptakan oleh seorang doktor ruang gawat darurat yang ingin memberikan kemudahan dan kenyamanan bagi orang-orang untuk mencari doktor dan menjadualkan janji temu secara online. Saat ini, ZocDoc memiliki lebih 25 juta pasien dan 50,000 doktor di platformnya dan tersedia di lebih dari 40 negeri bahagian di seluruh Amerika Syarikat. Pasien dapat membuat temu janji dari desktop atau perangkat selular. Mereka akan menerima konfirmasi melalui email atau SMS. Di Republik China, telemedicine merupakan bahagian yang berkembang dalam sistem layanan kesihatan China dan mencakup telepsychiatry. China mengatur dua model telemedis. Diagnosis dan pengobatan melalui internet, di mana seorang profesional kesihatan terdaftar memberikan diagnosis dan pengobatan online kepada pasien. Dan yang kedua, layanan medis jarak jauh. Dua atau lebih institusi medis menggunakan internet dan teknologi lain untuk mendiagnosikan dan merawat pasien. So there are platforms available in China like Hardoff.com, WeDoctor and Ping An Doctor that offer telemedicine consultations. Telepsychiatry, which is a branch of telemedicine, became extremely crucial during the COVID pandemic and even post-pandemic, because there are a lot of people who are suffering from psychiatric or psychological issues. And somehow with telemedicine, seeing the doctor online gives them the confidence and the safe feeling that they are receiving the help and understanding that they need without being judged by the general population. Telepsychiatry adalah cara yang efektif untuk membutuhkan kesihatan mental pasca pandemik. Aplikasi kesihatan digital yang memungkinkan pemeriksaan jarak jauh dan pemantauan pasien juga sedang dikembangkan. So as you can see, there are many platforms already available and used in China. So what are the benefits of telemedicine? Manfaat telemedis. There is comfort and convenience. Dengan telemedis, masyarakat dapat mengakses layanan kesihatan dalam kenyamanan dan privasi di rumah mereka sendiri. Hal ini mengurangi kebutuhan untuk berpergian, mengatur penitipan anak dan meninggalkan pekerja. Ini memotong waktu tunggu dan memungkinkan orang untuk mengatur konsultasi sesuai jadual sibuk mereka. Sebuah studi pada tahun 2019 menemukan bahawa telemedicine menghemat banyak waktu perjalanan, biaya dan waktu jauh dari pekerjaan bagi orang dan keluarga mereka yang mengunjungi klinik telemedicine bedah saraf pediatrik. Other than that, there is increased access to from a distance. Telemedicine membantu membuat layanan kesihatan dapat diakses, terutama bagi masyarakat yang tinggal di daerah pedesaan. Sebuah studi pada tahun 2020 menemukan bahawa telemedicine memberikan akses itu terhadap layanan kesihatan bagi sebahagian masyarakat tanpa potensi stigma atau marginalisasi atau diskriminasi. Selain itu, konsultasi telemedis mungkin lebih terjangkau dibandingkan dengan kunjungan lanjung ke doktor dan masuk ke ruang gawat darurat. Tinjauan pada tahun 2020 menemukan bahawa terdapat pengurangan biaya kesihatan sebesar 56% dan biaya perjalanan sebesar 94% ketika doktor menggunakan telemedis di beberapa tempat termasuk ruang unit perawatan intensif care, pediatrik dan banyak lagi. Telemedicine also helps family support, memungkinkan anggota keluarga dan pengasuh untuk bergabung dalam konsultasi, mengajukan pertanyaan dan memberikan informasi untuk berkontribusi terhadap perawatan anggota keluarga mereka. If it is in the comfort of your home, the family members can contribute and say, no, actually my father's symptoms are more worse than what he's telling you. This is what he's facing. They can give better insight into the patient's well-being to the doctor to make the treatment more and the diagnosis more efficient and spot on. Telemedicine juga mengurangkan prevents chronic disease spread. So how does it do that? It actually reduces the people from coming to the hospitals and contracting infections from other sick patients. So you prevent chronic diseases, the spread of chronic diseases. And it controls the transmission of illnesses from one patient to another. All in all, it contextualizes assessments. Telemedicine membantu profesional kesihatan seperti ahli terapi okupasi dan fizik mengamati seorang di lingkungan alaminya. Hal ini memungkinkan mereka untuk melakukan evaluasi yang lebih menyeluruh terhadap kemampuan seseorang untuk bergerak dan berinteraksi dengan lingkungannya. This is something you cannot visualize when you are talking to the patient in the clinic of a hospital. But through telemedicine, you can see the patient's surroundings and can make better judgments on how the patient care should proceed. This is very important for rehabilitation medicine, especially. So we're coming now to the next set of electronic digitalization, which is the electronic health records. Ada banyak sistem HER yang tersedia di Amerika Syarikat dan sistem ini meningkatkan kualiti EHR or electronic health records. Now, the definition is a digital record of a patient's medical history that can be shared across multiple healthcare providers, not only in different clinics in a hospital, but also among different hospitals, which is so much more efficient instead of having typo errors or missing some important information when a patient goes for a follow-up in a different hospital. So these are electronic health records. Electronic health records can include diagnosis of a patient, medical history, what medication they are on, their previous admission records in a hospital, immunization, X-ray, laboratory results, clinical notes, progress notes, problems, and demographics. So all this is available online and can be shared in very strict confidential portals between prescribing doctors, physicians, and of course the patient. Berikut adalah 5 manfaat utama sistem EHR dalam layanan kesihatan. The first is improves quality of care, meningkatkan kualitas pelayanan. Sistem EHR menyediakan akses cepat dan mudah ke informasi pasien yang dapat membantu penyedia layanan kesihatan untuk membuat keputusan yang lebih tepat mengenai perawatan pasien. Memeriksa konflik pengubatan. EHR kerana EHR melacak pengubatan dan alergi pasien. EHR juga memiliki kemampuan untuk memeriksa potensi masalah atau konflik dengan obat baru yang diresepkan. The second one is increase efficiency. Meningkatkan efisiensi. Manfaat paling menonjol dalam sistem EHR adalah kemampuannya untuk meningkatkan efisiensi organisasi dalam layanan kesihatan. Beberapa proses administrasi umum yang dapat dibantu disederhanakan oleh EHR mencakup penjadualan temu janji. Dengan mengotomasikan proses penjadualan, EHR membantu mencegah kesalahan umum, misalnya pemesanan ganda, sekaligus menawarkan pembaruan penjadualan waktu nyata yang memungkinkan penyedia layanan menjadualkan ulang janji temu atau mengirim pengingat kepada patient to remind the patient of their upcoming appointments at the clinic using the electronic health records. EHR membantu mencegah kesalahan dan mengurangi kemungkinan perbayaran terlewat atau tertunda dengan secara otomatis membuat dan mengirimkan tagihan kepada pasien dan mengidentifikasi pembedahan seperti biaya duplikat atau kod penagihan yang salah. It prevents physical mistakes from typographic errors or personal physical errors from the individual healthcare providers. The third is boost patient engagement, meningkatkan keterlibatan pasien. Bagaimana? Dengan menumbuhkan lingkungan kolaboratif antara pasien dengan penyedia layanan kesihatan. Dengan menciptakan lebih banyak transparansi bagi pasien, EHR mungkinkan pasien untuk mempunyai lebih banyak hak untuk bersuara dalam layanan kesihatan mereka. Akses yang amal terhadap informasi kesihatan telah mendorong lebih banyak orang untuk mengendalikan kesihatan mereka dan secara aktif terlibat dengan penyedia layanan kesihatan mereka. The next is reducing medication errors. Unfortunately, this does happen due to human error. Akses mudah ke riwayat kesihatan pasien, terutamanya alergi dan obat-obatan yang ada, membantu mencegah doktor meresapkan obat yang dapat membahayakan pasien atau bertentangan dengan resap yang ada. Hal ini meningkatkan keselamatan pasien dan memastikan bahawa doktor dilengkapi dengan informasi yang mereka perlukan untuk memberikan rekomendasi yang accurate. And finally, enhancing data accessibility. Accessibility sistem EHR adalah satu alasan utama penerapan secara luas. Mereka meningkatkan accessibility bagi penyedia layanan kesihatan dan juga patient. Memungkinkan mereka mengakses rekam medis dengan mudah dari perangkap resmi manapun. Whether it is in the same hospital as I mentioned earlier or different hospitals, even overseas. This makes it so much easier and more efficient for the patient's records to be accessed by the healthcare provider, the new healthcare provider. There are many common EHR systems. These are all systems in the United States. There is the Oracle, Cerner, WellSky, Meditech, MedHost. These are among the more popular platforms whereby patients' records can be deposited, and these are actually utilized by the hospitals. They will adopt one of these systems in their healthcare organization and incorporate this EHR system to facilitate patient record, patient's data, and accessibility. Now, the third of the digitalization in healthcare is wearable technology and mobile health apps. Teknologi wearable dan aplikasi seluler bekerjasama untuk menciptakan ekosistem yang baru yang dapat meningkatkan kesihatan dan kehidupan sehari-hari. Aplikasi kesihatan seluler dalam bidang teknologi kesihatan digital yang sedang berkembang dan ditujukan untuk diagnosis, pengobatan atau pencegahan kondisi kesihatan atau penyakit. Aplikasi ini dapat menyimpan dan melacak informasi kesihatan, memberikan informasi pendidikan kesihatan, menawarkan pengingat kepada pasien dan menggunakan pelacakan GPS untuk mengarahkan atau mengingatkan pasien. Teknologi wearable dalam layanan kesihatan mengacu perangkat terpasang pada tubuh untuk mengumpulkan data terkait kesihatan pasien untuk dianalisis dan diteliti oleh doktor, perusahaan asuransi dan pihak lain. Manfaat teknologi yang dapat dikenakan dalam layanan kesihatan termasuk meningkatkan pemantauan kesihatan secara real time. Real time enhances real-time health monitoring of the patient using wearable technology devices. It also increases access to healthcare data, meningkatkan akses terhadap data layanan kesihatan, detects potential health issues early, deteksi potensi masalah kesihatan sejak dini, support for chronic disease management, dukungan untuk menanjamin penyakit kronis, personalized healthcare plans, personalisasikan rencana perawatan kesihatan, and reducing healthcare costs, mengurangi biayai perawatan kesihatan. Now, I want to share with you an actual instance where digitalization, or rather the Apple Watch, which is a wearable healthcare device, actually saved the life of the user. Salah satu contoh aplikasi seluler yang sangat bagus di perangkat kesihatan adalah Apple Watch. Baru-baru ini, Apple Watch telah menyelamatkan nyawa seorang pria setelah dia terjatuh dari sepeda listriknya. Setelah terjatuh, Apple Watch segera memberitahu pihak berwenang terkait informasi. Okay, sorry. Let me carry on. Setelah dia terjatuh, Apple Watch segera memberitahu pihak berwenang terkait informasi lokasinya. Ketika layanan darurat tiba, mereka menemukan pria itu tergeletak di jalan dengan pendarahan hebat di kepalanya. menyelamat nyawa pria itu berkat Apple Watch. This is actually a true incident, and it's also a very good advertisement for Apple. But I have seen the benefits of the Apple Watch. For instance, my husband, who's a diabetic and has high blood pressure, the Apple Watch actually sends him reminders that he hasn't drunk enough water or his heart rate is suddenly accelerated. So they want to know why. And that sends a reminder to my phone. So I know I will call him and he says, no, I'm doing gardening. I'm doing something active. So I know he's okay. So this is very beneficial for us to monitor ourselves and for other people to come to our help when we are in trouble. So really, this is a very beneficial tool. And Apple Watches are available globally all over. Of course, there are challenges in anything. As far as there are advantages, there are also challenges. Tantangan dalam layanan kesihatan digital, salah satu adalah, as in the middle, masalah privacy dan layanan kesihatan, masalah privacy, dan keamanan data. Data layanan kesihatan pasien bisa menjadi bentuk data yang paling sensitif. Of course, our data protection and security is utmost. It's very important. We don't want our personal data to be shared with all and sundry, with other people, when it's none of their business. So privacy concerns are very, very real. Kekhawatiran mengenai privasi data dan keamanan cyber yang beralih seiring dengan kesihatan digital cukup beralasan. Meskipun sebahagian besar solusi ERP administratif yang tersedia saat ini dapat diterapkan di lingkungan layanan kesihatan, solusi tersebut masih belum memiliki pensyaratan keamanan yang ketat. There are still concerns regarding data protection and security despite the platforms that are only accessible in hospitals. We have heard of cyber attacks and cyber threats. So these are continuously being monitored by the digital companies to overcome and to protect, put up firewalls to prevent these cyber threats, to maintain the data protection and security. So masalah ini menimbulkan walau bagaimanapun pertanyaan mengenai pemilihan opsi yang tepat untuk solusi layanan kesihatan digital yang mengatur dan melindungi data patient. It is an ongoing process, ladies and gentlemen. I will not lie. There are still many things we can do to improve it, but there are hundreds and thousands and millions of dollars invested in this very field of cybersecurity. And then there's resistance to adopting digital health. Resistance terhadap perubahan. They don't want to change. Profesi doktor pada dasarnya adalah salah satu profesi yang tertua yang dikenali dalam sejarah manusia. Dan sebahagian besar organisasi layan kesihatan memiliki warisan yang bertahan selama beberapa dekad bahkan lebih. Lembaga-lembaga seperti ini resistant terhadap perubahan. They are resistant to digitalization, terutama perubahan yang bersifat transformasional dan organisasional, yang mana transformasi digital dalam layanan kesihatan menjanjikan. They are very resistant. They still believe in face-to-face. Yes, of course, who doesn't want to see their doctor, to shake their hands, to thank them? But the benefits outweigh the disadvantages. We must embrace change. Not everything will be online. We won't be performing surgeries online, no. But where we can streamline certain services to digital health, we should adopt it and embrace it. And then there's the masalah interoperabilitas. Tampaknya solusi layanan kesihatan digital memiliki hambatan lain yang harus diatasi, yang tampaknya merupakan produk sampingan dari resistensi organisasi layanan kesihatan terhadap perubahan. Masalah interoperabilitas. Sistem lama dan aplikasi digital yang lebih baru tidak dapat ngam. So the equitable access, addressing the socio-economic barriers is another one. And then there's digital literacy, bridging the tech gap for all ages, menjembatani kesenjangan teknologi untuk segala usia terutamanya di kalangan mereka yang berusia lebih tua. It is more difficult for them to embrace the technological advances. And then we have the also added complication of less qualified staff. Layanan kesihatan yang pernah beroperasi di bidang terpisah dan jarang tumpang tindih. Namun saat ini revolusi digital di bidang layanan kesihatan telah menggabungkan kedua bidangan IT dengan layanan beroperasi, sehingga menciptakan lingkungan baru yang dinamis. Praktisi kesihatan termasuk doktor kini berupaya untuk menguasai alat digital untuk mentransformasikan profesi mereka. Namun demikian, transisi menuju kemahiran teknologi terjadi secara bertahap dengan hanya segelintir pengguna awal yang berada di garis depan. It is still a minuscule number of staff who have actually embraced learning and the digital technology apps and applications. To move forward with digital health adaptation, we need to have more and more of the staff being more well-versed in digital aspects of healthcare provision. So how do we do this? We need to assess the current systems, our current systems, and identify where the gaps are and what opportunities we have for improving. Risk assessment, very straightforward risk assessment. Identify the gaps, identify opportunities, and take over. And then to choose appropriate technologies. Kita harus cuba mendapat teknologi yang sesuai untuk organisasi kita to match solutions to specific needs. Salah satu cara terbaik untuk memastikan bahawa transformasi digital mempunyai pijakan yang kuat dalam organisasi layanan kesihatan adalah melalui a Chief Technology Officer. Every healthcare organization that is embracing digital health must have a digital Chief Technology Officer. Kerana orang ini akan memiliki posisi yang lebih baik untuk mengadvokasikan teknologi baru sambil mencari solusi layanan kesihatan digital yang selaras dengan visi dan misi organisasi. Then, more importantly, staff harus mendapat pelatihan yang diperlukan. Pasien harus mengakses infrastruktur untuk mulai menggunakan solusi layanan kesihatan digital. Ini harus diciptakan. Dan kemajuan baru dalam teknologi kesihatan perlu dilacak. But finally, we must have continuous improvement by monitoring and optimizing our systems. For us, it is still very new. So when we launch the systems, we need to monitor how do the patients feel? What are the difficulties they face? What are the difficulties the hospitals face? And how we can optimize our current digital technology. How can we overcome the challenges faced by both the patients and the healthcare providers? So by doing this, we can really embrace digital technology, which is becoming more and more a part of healthcare provision services. So in conclusion, ladies and gentlemen, technology is revolutionizing healthcare delivery. And there are many data-driven insights that can improve patient outcomes should we choose to improve and embrace them, like the electronic health records, telemedicine, the wearable healthcare units. There will be challenges existing because there is a resistance to embracing this technology. We are always afraid of something we are not sure of, something that's new. But the benefits outweigh the drawbacks. We must see that to move forward for the betterment of healthcare systems, provision of healthcare services. Because, ladies and gentlemen, the future of healthcare is digital and personalized. Are there any questions? Thank you.
Okay, thank you very much for Prof. Dr. Gita for giving us such informative and interesting presentation. I think all participants have understand. Okay, ladies and gentlemen, now we come to the question and answer session. If you want to ask question, please raise your hand and stand up. Okay?
Oke, bagi yang ingin bertanya, silakan untuk mengangkat tangan dan bisa berdiri.
Okay, please stand up. And don't forget to mention your name and program study.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi.
Baik, perkenalkan nama saya Anissa Rizky Snaini dari D3 Fisioterapi semester 3. Saya ingin bertanya tentang how does telephysiotherapy enhance mental healthcare delivery? Thank you.
Okay, thank you.
Thank you very much. That was an excellent question.
Okay, I want to repeat the question. How
Okay.
does telepsychiatry enhance mental health care delivery?
Thank you.
Answer.
I'd
Okay.
like to share something. Can you hear me?
Yes.
Okay, thank you. Very good question. I'd like to share something that we practice in Inti International University. We have a physiotherapy unit. Now, during the pandemic, the students obviously couldn't come to the university, but they needed their hands-on practical. So what we used was a form of telemedicine. The lecturer will actually, well, it was more tele-education. The lecturer will ask the student to switch on their laptops, and they will ask their students to have a family member pretend to be a physiotherapy patient. And the lecturer will also have another lecturer there, and they will be demonstrating certain exercises, certain physiotherapy processes. So the student was practicing on their family members by watching the lecturer. So the lecturer could correct what the student was doing. So we did that individually with all the students, and then we asked the students to make a recording of the treatment that they were giving their patient. So similarly, if we could do that during the pandemic, similarly, when a patient has to do rehabilitation especially, it's difficult for them to come all the way to the hospital, to queue up, to wait, to do the physiotherapy exercises, unless they need specific equipment. So what they can do is, using telemedicine, the physiotherapist can demonstrate to the patient what they need to do and ask the patient to do the exercise and show them to see if it is the right way of doing it. Does that answer your question?
Okay.
Yes, so the answer is fisioterapis bisa mencontohkan ya melalui media, bisa video atau mungkin by Zoom ya, namanya telemedicine. Jadi nanti ada fisioterapis yang melihat, kemudian pasien melihat fisioterapis mendemonstrasikan apa gerakan yang harus dilakukan, kemudian pasien disuruh mengulangi apakah sudah betul atau belum gerakannya. Is that correct, Prof?
Correct. Perfectly correct. Thank you.
Yes.
Another question? Please yeah. Okay, stand up.
Can you come forward?
Mundur, ya mundur sedikit. Sini.
Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi dan izin bertanya, bagaimana menjalin kolaborasi yang baik antara 3 generasi, yaitu generasi X, generasi Y, dan Gen Z, dalam menjalin kolaborasi perubahan pemberian informasi kesehatan meliputi cara kerja obat, penyuluhan kesehatan, baik tentang penyakit kronis dan penyakit seksual yang tepat dan komprehensif, yang dapat mengubah dari cara pencapaian secara langsung menjadi pemberian informasi melalui dunia digital. Bagaimana hal ini bisa berjalan dengan baik? Terima kasih.
So Professor, maybe I will help a little bit, maybe in
Yes,
English.
please.
Okay. So he asks about how the health digital transformation can connect between the old generation and the new generation regarding the information about using medicine and then education to the patient, like for sex education, etc. So sorry, gimana tadi Mas pertanyaan yang awalnya? Oh yeah, how to collaborate between the old generation and the new generation regarding using the digital health services.
Thank you. Very interesting question. Basically, when we talk about collaboration, we do know there's a generation gap between the Gen Zs, the baby boomers, the Gen X, etc. But ultimately, you have to think that the common goal here is improvement of knowledge. And digitalization in healthcare services can definitely do that for you. If you're willing to embrace the new digital technologies, when we're older, it's more difficult. But if you really want to, you can learn. People will teach you. And currently, that is how millions of people all over the world are doing it. They're doing it because they can see the benefit. So to bridge this gap, it's really up to all of us, isn't it? To do the collaboration. And yes, I think sex education is extremely important and should also be something that is taught not only over telemedicine, but also in schools, in universities. We have to make our young people more aware, not about sex, but about the dangers with unprotected sex and sexually transmitted diseases. So with chronic disease transmission as well, as I mentioned in my talk, in the hospital, it is quite common to pick up somebody else's infection. I go because I've sprained my leg, but there is another orthopedic patient who's having the flu. I might go home and pick up his flu germs because flu is airborne. So again, if we minimize the contact, unnecessary contact in a physical clinic and have the telemedicine and digital apps to help educators and help to have the consultation online, I think this will benefit all the generations, whether it's Gen Z, Gen X, baby boomers, etc. I hope I've answered your question.
Masnya sudah paham apa belum untuk jawabannya? Ya. Okay, thank you, Prof. And the next question, please raise your hand.
Hello, my name is Kian Kitara Dirani Salima. I'm from study program is nurse. Question is, what impact does digital transformation have on the gimana?
Have on the?
Yes, wait a minute, Prof.
Okay.
Sorry.
It's okay.
My question is, what impact does digital transformation have on the accessibility and efficiency of healthcare service, especially in remote area? Thank you.
That's an excellent question. Sometimes healthcare facilities and services, it's more difficult to reach remote areas for the sheer distance and inaccessibility. So with telemedicine, provided there is proper internet access, at least the patients, the physicians can still communicate. So the medication, the diagnosis, the one-on-one communication between patient and healthcare provider can still be done. And this was very well defined during the COVID pandemic because there were so many outliers in the rural areas that could not access proper healthcare. They were afraid, they didn't know what was going on. But with telemedicine, they were given proper advice. They were given advice on how to manage, whether or not they were suffering from COVID-19. And now it's no different. We can just make that better and more efficient to reach out. We want to reach out everybody. I hope I've answered your question.
Okay, thank you, Prof. So another question? Any question? Okay. Okay, please stand up. Stand up.
Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, saya Etiwa Datu Zara dari D3 Farmasi. I have a question regarding your presentation, Prof. Can you tell us what are the obstacles to implementing telemedicine in your country? Because in Indonesia, patients with low education and economy levels difficult to keep up the technology. Thank you.
Okay.
That is an excellent point. Thank you very much. Actually, last year in 2024 March, our Ministry of Health announced that they were going to invest more in telemedicine and in digital healthcare. So a study recently was done based on the 1 year of less than 1 year of starting to use telemedicine. And they found that while it benefited a lot of patients, there was still a lot of room for improvement. And your points are excellent. People who don't have access to mobile devices or internet access will definitely not have access to telemedicine. This is a gap we are trying to reduce. So we are trying to make telemedicine accessible for more people. And probably at certain points where they can come and they can use the digital services or they have digital access. to internet, etc. And then they can communicate with the doctors. So this is still work in progress. But we have started, and there is continuous monitoring to see how effective and where we can close the gaps and make it a more efficient and more integrated tool in our healthcare system. But I do agree, trying to reach out to everybody, especially those who cannot afford or do not have access to internet and internet devices, will be a major challenge in promoting digital healthcare. So thank you for your point.
Okay, thank you. So next question. Okay, stand up. Disiapkan yang belakang, maju dulu nggak apa-apa.
Previously, thank you for this opportunity. Let me introduce myself. I am Bilkis Nailata Zakia from Science in Hospital Administration Study Program. May I ask how technology can improve patient data management without violating privacy and information security? Thank you.
Okay, thank you.
Very, very good point. As I mentioned earlier, there are platforms specifically within hospitals, we call them LIMS, or online information systems, information management systems that are supposed to be private and confidential, only accessible by healthcare providers and some of the patients to their own records only. Like I'm sure in university, you have your online learning portal where only you can see your results, your friends cannot see your results. So that is security in a manner of speaking. So there are specific platforms to access patients' data, to communicate with doctors. Unfortunately, we are very aware that cybersecurity threats are also there. There are many cybersecurity attacks. There are people who are trying to illegally access data for monetary gain. And that's why firewalls have to be very strong. We have to continuously adapt our systems, continuously look out for threats. It won't go away because people are not very nice, some of them. They want to harm us or destroy, certain platforms. So we must be very vigilant in the field of telemedicine and telecommunication. Did I answer your question?
Okay. Any question? Ayo, stand up. Okay, Prof, two more question again, yeah? Okay.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Hello, my name is Arma Octavia. I'm from Occupational Health and Safety. So my question is, how can digital health service support early identification of health risks in the workplace? Thank you.
Okay, thank you.
That's a question quite close to my heart because I'm a lead auditor for occupational safety and health in INTI. How can it identify safety and risk at the workplace? Okay, that is a bit more complicated. You need a different platform, a different set of software for that, because what we're talking about with telemedicine and healthcare apps is about the patient. It's about provision of medical services from doctor to patient. But what we can do is, as individuals in the occupational safety and health field, we can input the data. If we see something wrong, we can input the data into a system or into a program to monitor the risk level using the risk matrices. There's like high risk, low risk, etc. So using our software, we can actually try and monitor the risk level, but the input has to be, because you're talking about a situation about your workplace, about the work environment. So that is a little bit out of context of this talk, but I hear you. Yes, it's very important. So as individuals, if you can use the online digital systems to somehow create a platform where you can monitor and evaluate the risks in your workplace, it would be excellent. I hope that answers your question.
Okay, thank you, Prof. The last question. Okay, please stand up. Ayo, come forward ke depan.
Assalamualaikum warahmatullahi wabarakatuh. Excuse me, Miss. My name is Sophie Octaviani. I'm a midwifery student. This is a question for you. How can digital health service ensure inclusivity and accessibility to maternal and child health service, particularly for marginalized groups, especially in remote and underserved areas? As is known, most marginalized groups, especially remote areas, have not been touched by digitalization. And from this case, how is telemedicine implemented in my midwifery service for mothers and babies? Thank you.
That's a very good question. Unfortunately, you have actually brought up a serious issue. Telemedicine digitalization is not accessible to everybody in the remote areas, but it should be. And this is where the Ministry of Health in all our countries, all our Southeast Asian countries, all over the world actually, we need to make sure that there is accessibility to especially the remote areas where they need it the most. Because as a midwife, you know that maternal fetal health is crucial, especially if there are complications. The mother has to receive care, or the pregnant person has to receive care as fast as possible. So yes, I agree with you. It is very important. It is actually a thing in the US. They've already managed to digitalize it, but they have better access in several areas, not everywhere, but in more areas. So midwifery is actually one of the areas that has benefited from telemedicine, digitalization, and I hope that we will benefit from it soon because really our rakyat need it. Thank you.
Okay, thank you, Prof. So again, I would like to thank you, the speaker, for the informative and interesting presentation. So give the applause for the speaker and for you all. Okay, we finally come to the end of the session. Before I close the session, I would like to say the conclusion. While digital transformation in healthcare several challenges, the benefit it offers for outweigh them. The future of better, more affordable, and more personalized healthcare is now achievable through digital technology innovation. I would like to apologize to all of my faults. And that's all from me. Thank you for your attention. I return back to the MC. Wassalamualaikum warahmatullahi wabarakatuh.
Okay, Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you so much for Mrs. Yeni for guiding us through the session. Hello. Okay, yeah. Before we close today's agenda, we would like to take a moment to formally recognize and express our appreciation to our guest lecturer for her exceptional contribution on this season. And the committee, can you prepare the certificate? Ms. Retno? Ms. Retno? Okay. The insight provided today will undoubtedly leave a lasting impact on all the participants, and inspire further learning and also exploration in this field. Okay, As a token of our gratitude, we are honored to present this certificate of appreciation to Professor Dr. Gita Subramaniam. This certificate is awarded in recognition of your outstanding dedication and effort to sharing your knowledge and expertise to us this event. Thank you so much, Professor. Okay, before we close, we have a photo taking session. Yeah, maybe Professor, could you look at the camera? We will take a picture. Okay, let me count for you. Yeah, and all the participants also. 1, 2, 3. Okay, maybe the participant can look back at the camera. Bisa lihat ke belakang kamera ya semuanya. Okay, and smile ya. Okay. Oke, semuanya lihat ke belakang biar kelihatan di kamera ya. Oke, noleh ke belakang sebentar ya. 1, 2, 3. Oke, say hello and smile. Oke, ya. Thank you. Finally, we got the last session that is closing. Let's close our today's agenda by reciting Hamdalah together. Alhamdulillahirabbil alamin. On behalf of the Faculty of Health Sciences, Universitas Muhammadiyah Lamongan, again, we would like to thank our guest lecturer, Professor Dr. Gita Subramaniam. Thank you so much. We officially close today's agenda. Thank you for you all for being a part of this event and have a great day. See you on the next guest lecture. Wassalamualaikum warahmatullahi wabarakatuh. Thank you so much, Professor. Bye-bye. Oke, untuk resume bisa dikumpulkan di